good health is the first prerequisite for happiness. Good evening, viewers. Welcome to an exclusive health talk, BMC Global Live AL-HILAL Health World. Nothing but lifestyle. Myself, Marina Francis. Today, our topic for discussion in this week's Health World episode is urinary tract infection or UTI. Yes, a very common health problem that many encounter, especially during this hot season. So let us hear more from the doctor joining with us today. Dr. Soraya Dimaano, having practicing general medicine for more than 11 years. She has also taken training for pediatric residency for more than 3 years, currently working at AL-HILAL Hospital, Muharraq branch. We are very happy to welcome Doctor in today's Health World episode. So let us hear more from her about the topic. Good evening, Doctor.
Good evening.
Thank you so much for joining with us in this Health World episode.
It's an honor to be here.
Thank you, Doctor. Doctor, may I start by asking what exactly is urinary tract infection or UTI?
Okay. Urinary tract infection or UTI is one of the most common infections that we encounter in the clinic or in the hospital. It is the infection of the urinary system.
Okay.
So it involves three parts: the kidney, which is a bean-shaped organ that filters our blood every minute, removes waste, hence producing urine.
Okay.
And then we have the urinary bladder, which temporarily stores this urine. And then we have the urethra, which is a duct that transmits the urine from the urinary bladder out of our system during urination.
Okay. So, Doctor, what are the causes of UTI?
So the causes of urinary tract infection is the bacteria. Most of this bacteria lives around the area of the anus and the vagina and the skin. And when this bacteria enters the urinary tract, they multiply in the urinary bladder, hence causing infection. So secondly, among babies, infrequent diaper change can lead to UTI. And among toddlers, urinary tract infection occurs during the toilet training stage. It is when they try to hold it in, the urine. That's why it is very important that we teach proper bathroom habits and avoid holding it in.
Okay.
And also, urinary tract infection mostly affects women at a ratio of 10:1 compared to men, which means that women are 10 times more prone to develop urinary tract infection than men.
Okay. So, Doctor, what could be the reasons behind that?
Okay. So first is female urethra is shorter than male urethra,
Okay.
which shortens the distance that the bacteria travels from the urethra to the bladder. Secondly, female urethra is in close proximity with the anus and the vagina. Infection in these areas, infection in the urine, infection in the vagina, infection in the anus can transfer to the urethra, thereby causing UTI. And then lastly, as women age, circulating hormones like the estrogen declines, which causes changes in the urinary tract, thereby predisposing us to UTI.
So, Doctor, what are the symptoms that a person infected with urinary tract infection may show?
Okay, clinical manifestations of UTI depends on the area affected. So if it's the urethra, which is urethritis, patient may experience painful urination.
Okay.
When it already involves the bladder, patient may experience urgency,
Okay.
which is unable to hold in the urine, frequency, more frequent passing of urine,
Okay.
abdominal pain, and then when it involves the kidney, a patient may have a fever, flank pain, nausea, vomiting, and sometimes diarrhea. And among babies, they would exhibit irritability, poor feeding, and weight loss.
Okay. Definitely, she has given us a very brief introduction about UTI. We need to know how we can prevent or how we can treat this infection. We will be back after a very short break, so stay tuned. Welcome back. You're watching BMC Global Live AL-HILAL Health World. Our topic for today's discussion is UTI, urinary tract infection. So let us proceed with the remaining questions. Doctor, what could be the risk factors or other factors that may contribute to UTI?
Okay, risk factors for UTI. First is constipation,
Okay.
especially among kids. When the stool fills up the colon and the rectum, it presses pressure on the urinary bladder, thereby unable for the urinary bladder to empty itself. And this stagnant urine in the bladder is a good environment for the bacteria to grow, hence causing infection. Secondly, uncircumcised male. Studies have shown that uncircumcised male are more prone to develop UTI because the bacteria tends to adhere on the foreskin.
Okay.
Third is pregnancy.
Okay.
During pregnancy, the uterus sits directly on the urinary bladder. So as the uterus increases its weight, it presses pressure on the urinary bladder, hence, again, uh, delayed emptying of the bladder causing infection. There are also hormones during the pregnancy that changes the urinary tract causing UTI, more predisposed to UTI. And then third is bubble bath, which is kind of controversial, bubble bath among kids. Studies have shown that some bubble bath soaps irritates the urethra, predisposing them to UTI. And then among women, wiping after urination or bowel movement, wiping from back to front. As I've said, the bacteria from the anus can transfer to the urethra, causing UTI.
Okay.
And then wearing tight clothing. This traps moisture, which is a good environment for the bacteria to grow. And then lastly is sexual intercourse.
Doctor, what if the UTI is untreated? What could be the complications?
Okay, urinary tract infection, when treated promptly and properly, rarely leads to complication. But if it's left untreated, it may lead to recurrent UTI among pregnant women delivering premature and low birth weight babies.
Okay.
And then among men who have frequent urethritis can have narrowing of the urethra. And then the last one is sepsis, which is a life-threatening condition when the infection ascends to the kidney and into the bloodstream.
Okay. Doctor, so very important question in today's episode would be how to manage UTI.
So after a thorough history and a physical examination with the aid of basic tests like urine analysis, urine culture, and sometimes CBC, antibiotics are the first line treatment for UTI.
Okay. So doctor, all of us viewers, we want to know how to prevent UTI.
Okay, UTI is preventable. Here are some of the steps that we can prevent UTI. First is drinking a lot of water.
Yes.
This would dilute our urine and then would ensure that we pass urine more often, thereby flushing out the bacteria.
Okay.
And then secondly, circumcision. And then third is emptying our bladder as often as we need. Like if we have the urge to pee, then let's need to go to the restroom. And then wiping for women, wiping from front to back to avoid the bacteria getting into the urethra. And then for women, avoid potentially irritating products like douches and powders. And then last is, of course, wearing cotton or loose-fitting clothes.
Okay. Doctor, you have mentioned many aspects and all the aspects we need to know about UTI. Can you give us a short take-home message for the viewers?
Okay, urinary tract infection is preventable. However, if ever you have the symptoms, don't self-medicate. Visit the nearest clinic or hospital and have yourself checked. Because in UTI, recurrence is high, renal scarring is a consequence, and permanent kidney damage can be as a result.
Okay. Thank you very much, Doctor, for joining with us today and answering all of our questions regarding UTI. Definitely, it would have been a very useful episode for viewers. Please do take care of your health. It is very important to maintain a healthy and happy life. Until we meet again in the next episode of Health World next week, same day, same time. This is Marina signing off. Stay safe, stay home. Good night.